Today's video it's about vaginal thrush, also known as candidiasis or vaginal yeast infection, which happens to be the most common type of infection that makes woman itch down below. The thing is that it's not about your age. A child can itch, a girl child can itch, a woman in her teen can itch. Do we call her a woman? No, she's still a girl. So a girl in her teens can itch. Then a woman, 20, 30, 40, 50 can itch. Even 70, 80, they can itch. What is behind it? Studies have it that up to 75% of women are going to experience itching in their lifetime at least once. If it's about a woman is itching once a year, we might not have a problem. But I'm talking about recurrent itching. Every 2 weeks, you're itch. Every month, you're itching. And there are some ongoing mites. Some women believe, I'm sleeping around, that's why I'm itching. No. My partner is sleeping around, that's why I'm itching. No. And they become so embarrassed to discuss it. Sometimes they don't even talk about it. They're not even seek for solution directly. They are looking for indirect ways to handle it because there is this notion that if you're sleeping around, you are going to have itching. But that is not true. We're going to discuss the risk factors. First, understand that vagina is part of your female reproductive organ and it performs three major functions. Number one, vagina serves as a passageway for blood and mucosa tissue to go through in a woman's menstrual cycle. Okay. Two, it holds the sperm. It holds the penis during intimacy so that the sperm can pass through it to the uterus, the womb, before it travels to the fallopian tube to meet the release egg. Three, it serves as a passageway for childbirth for a woman that is in labor and wants to deliver. It's through the vagina that the baby is going to come out. All right. So the vagina is very, very important. It's not something you should be ashamed to talk about when you notice something is not right with it. So before we go into the risk factors, you need to understand what is causing vaginal thrush. What is this candidiasis all about? Why am I always itching? Why is it that each time I go for high vaginal swab tests, they always report numerous yeast cells seen? Each time I go for urinalysis, urine MCS, they always report yeast cells, 3 pluses, 2 pluses, 1 plus, and it's itching me, it's disturbing me, it's giving me a concern. You need to understand that vaginal thrush, that is yeast infection, normally we have yeast cells present in our system. But the itching, the candidiasis, the thrush comes up when there is an overgrowth of these yeast cells. So the question should be, what is causing the overgrowth? Why am I constantly dealing with overgrowth of yeast cells? We have several reasons why women deal with overgrowth of yeast cells in their system. Okay, number one is there is what is called being overweight in response to insulin resistance, which drives inflammation in your system. This in turn weakens your immune system. When your immune system is weak, it's not strong enough to fight off invading infections. It's not even strong enough to create a balance between the fungal infection and other bacteria. What happens in that situation is that the yeast infection begins to multiply. They just begin to multiply, all right, out of control. And one of the symptoms you get is itching. We'll still get to symptoms, how you will know, all right? Then another risk factor is unmanaged diabetics, whether type 1 diabetics or type 2 diabetics. These days, you and I know that dealing with diabetics is not about your age anymore. Somebody as a teenager can be dealing with diabetics. Somebody in 20s, 30s, 40s can be dealing with diabetics. So if the diabetic is poorly managed or not managed at all, it creates a conducive environment for more yeast cells to thrive, for an overgrowth of these yeast cells, and that can lead to candidiasis. And one of the places it manifests, it's your vagina. Actually, where you're itching is the outer part of your vagina, which is the vulval area. All right. Then another risk factor is people that have formed the habit of always doing self-medication, especially antibiotics, birth control pills, some kind of steroid injections, or even pills. They impact your immune system. In fact, they change your microbiota flora. They change it very, very well. So that way, yeast cells have upper hand and they begin to multiply and overgrowth. So you want to stay away from constantly pumping your system with antibiotics. So many times, some women are itching. The first line of action for them is actually to go and start taking antibiotics. The first line of action is for you to get tested so that you know the extent of the yeast infection. And again, it's not only yeast infection that can cause itching. A woman can be dealing with bacterial vaginosis. It can cause her to itch. You can be dealing with trichomonas vaginalis. It can cause you to itch. So it's important you do a test first to know the extent of the yeast infection present and even to confirm that actually it's yeast infection that you're dealing with, because the remedy we'll be sharing here will work only for yeast infection. That is Another risk factor that we're going to consider is being pregnant. When a woman is pregnant, it increases her chances of developing yeast infection because of altered immune system. Finally, some women that are in habits of using all kinds of scented sanitary wares. You want the sanitary wear to be all sexy, aromatic, and all of it. What happens at that time is that it alters the vaginal pH. And actually, this overgrowth of fungal yeast, this fungal infection, these yeast cells happens when there is an imbalance in the yeast cells around the vulval area. Once that happens, you can begin to develop vaginal yeast infection. That is overgrowth of yeast cells. So you want to pay attention to what you're using as your sanitary pad. That has the capacity to affect the pH of your vagina. We need the pH of the vagina to be acidic normally. And towards your ovulation, the pH of the vagina tilts towards alkaline. So it can actually support the alkaline nature of the sperm too. And that ends it because ovulation lasts for 24 hours. The fertile days too varies, okay? So the body switches back to being acidic. You want to maintain that acidic nature. That is one of its protective mechanism, its protective barrier against yeast infection, bacterial infection, and other microorganisms, all right? So let's look at the symptoms of candidiasis. How do you know? Studies have it that if you're experiencing one or two of these symptoms I'm going to mention, chances are that you're dealing with candidiasis. But remember, it's important you get tested first before you conclude. All right. So 80% of women that are dealing with candidiasis are going to experience vulvar itching. That little girl of yours could be itching. So when you notice your child is itching, don't worry. When we get to the home remedy, you see the home remedy you can use to help that child, okay? So when you notice that you yourself, you're itching as an adult, it's especially around your vulval area. And it could range from being intense itching, like, oh my God, as if there's a pepper they poured down there for you. Or it could just be mild, just that walking kind of itching. You're walking, but you're using your lap to itch yourself. It could be that. The dancing kind of itching. That's the word I'm looking for. You could experience that. All are pointing towards candidiasis, all right? Then two is a change in your discharge, which could be creamy discharge or cheesy-like discharge. Normally, your discharge is supposed to, it's not supposed to be too creamy, it's not supposed to be cheesy, because these yeast cells, they form in clusters and they can foam. So that changes automatically the kind of discharge that comes out from your system. So when you notice that creamy discharge, that's cheesy discharge, check it. Sometimes it might not even be offensive, like it might not have an offensive odor. All right. So many women get to be like, it's not offensive, so it's not something to worry about. As long as the discharge has changed and you notice itching, you should worry about it and do something about it. Another symptom is painful intimacy. You will notice that each time you're having intimacy, which is supposed to be pleasurable, but you're in pain, something is off. All right. Do you know that candidiasis, vaginal thrush, is one of the leading causes of blocked tubes? So that is why you're not going to treat it just like that. It's a serious matter, and your hands must be on deck to see that you don't create an imbalance in your vaginal area, so that your system maintains a healthy balance and not allow the overgrowth of the yeast cells in your system. All right. Another symptom is soreness, redness, or even swelling around your vulval area and your vagina. When you use mirror to check yourself, you notice that that place is swollen, is reddish, especially if you're fair in color. You notice it's very red and you're worried. Okay, it's not time for you to look for something more acidic and pour on it. No, this vaginal itching, it can get intense because you have itched it so much, it can swell, it can cause the redness, and it can cause that soreness. All right. Then other women can experience like skin cuts around their vulva area. They just notice there are tiny cuts around that area. When you're wearing your pants, you just notice one sharp pain like that. Or when you're bathing, soap touches your anal region, that vulva area, you just notice there are cuts around there. Tiny cuts. Sometimes your eyes can't see it, but the water sees it. You feel it when water touch it. You notice it when like a soap touch it. You just notice it. Okay, so this is a sign that some cuts are out there. So what are you going to start doing? What is that home remedy? That home remedy I'm about to share, maybe you know it, maybe you don't know it, or maybe you know it but you've been neglecting it. Like, can this really do this? Some people have that mindset that simple home remedies are not for them. They're looking for complicated things to do. But you and I know that it's simple things that God is using to confuse the wise. So get it ready. Number one is you need garlic. You need garlic. Honestly, garlic is just that active home remedy ingredient that you need. to cause this change, to stop this, okay? Number one, how do you use this garlic? You have two forms that you can use it. Is it that you put it in your meals and cook? Actually, three forms. You can be using it to cook. That way you're strengthening your immune system. That way the garlic is dealing with the yeast cells, whether they're formed in clusters or they're in singles. It's going to break their bonds and not allow them to stay together again. All right. Or you can use garlic, make it coarsely paste, a coarse paste. Rub it around your vulval area, okay? Or you can even insert it. Get garlic, cut it into little, cut the full garlic like a cut, then insert on your vagina when you want to sleep. So let me know in the comment section if you've used garlic to treat yeast infection and it works, or if you will start using garlic, you're itching and you want to start using garlic to do this. Don't forget that you can use it as a paste, rub around your vulva, make it as a drink, prepare it as garlic tea drink, and drink at least consecutively for 2 weeks. Your body is going to tell you the truth. It's going to respond. All right. Then I want to share some lifestyle modifications that is going to really help you, because it's not just about you're taking pills, you're taking that and all of it. Yes, it's important you address some issues. For example, if you're overweight and you're dealing with candidiasis, it's time to work on your weight. I mentioned that one of the risk factors is managed diabetics or poorly managed diabetics. You are going to stabilize the blood sugar. If it's as a result of insulin resistance, you're going to shift and become insulin sensitive, okay? It requires lifestyle adjustment. These are tips so that sometimes you do so a remedy is not working. It's not just about that now. There are some modifications you're going to do, which is what I'm saying now. You're going to lose weight if you're overweight. You're going to become insulin sensitive or if you're insulin resistant, okay? If your personal hygiene as a woman or your girl's personal hygiene is not top notch, like it's not giving you what you want. If we score you and rate you and the ratio 1:10, you'll be scoring 1 or 0.1. You need to step up your personal hygiene. If you're not teaching that your daughter, that your girl, how to take care of herself, where she goes to urinate, how she wipes after urinating, how she takes care of her undies, very, very important, okay? So pay attention to your personal hygiene. It's going to help you a lot, because one thing with bacteria, fungal infection is that one drop is capable of multiplying. It's capable of producing millions, thousands of it. You want to make sure that one drop is not near you. Cut it by your good personal hygiene. It's going to be top notch for you. The garlic drink, your husband, your partner, he can take the drink with you, because sometimes the men are like, I'm not dealing with itching, so I'm not treating. He can take the garlic drink and treat with you internally, okay? Because the truth is that during intimacy there is exchange of fluid. So we're not saying he transferred the yeast infection or you transferred. The focus should be on getting solution. Thank you for watching.